Digital acceleration is here. Health systems are walking the path, but are they in the right direction? Welcome to Patient Journey Pioneers, roadmaps from the top digital leaders in healthcare, who share insights and strategies that are pushing the patient journey to new heights. This podcast is brought to you by Hyro, and I'm your host, Liat Kozuch. Welcome everyone to another episode of Patient Journey Pioneers. Today we'll be pioneered by Patrick McGill, Executive VP, Chief Transformation Officer at Community Health Network. Dr. McGill was named to Becker's list of top 30 most inspiring Chief Transformation Officers in 2022, which makes me very honored to host you during the episode today. So Patrick, it's great to have you.
Thanks for having me.
So before we dive into our questions, share with us a brief timeline of your journey in healthcare and what your role entails today at Community Health Network.
That's a great question. Happy to share the journey. So, it's interesting. I always say that I'm kind of an accidental administrative or leader. I did not go into my healthcare journey thinking that I would be in the position that I'm in. I'm a family physician by background, so I do still practice, which I think is very important for physicians that are leaders to still be on the front lines and still practice, still have that real world experience. But my journey started when I came to Community Health Network 13 years ago. I was just a practicing physician. We installed Epic in 2012, and I got involved in optimization. I wanted to make sure the system was better, that we didn't drop off any functionality or features. And, that led to becoming the medical director of physician informatics and became a physician builder with Epic. That eventually led to getting involved in a lot of our clinical variation activities. I at one point oversaw or led our product lines for growth, value-based care, and clinical variation. In 2018, I became the Chief Analytics Officer at Community. We created a new role for analytics and separated analytics into its own center of excellence, and I was asked to take on that role. And then in 2019, we moved IT underneath that Chief Analytics Officer role. So in my current function as the Chief Transformation Officer, I have a kind of a broad range of responsibilities from IT and analytics, clinical and nursing informatics, population health, also have responsibility for cybersecurity, business continuity, and then I have some other operational strategic partnership responsibilities as well. So we feel that that's a structure that works at Community. I know that I've talked to many others and sometimes people question, and I always tell them, I think each organization is unique. They have to find the structure that works right for them. And it's not a one size fits all. And what may work at Community may not work at other organizations. And I think that's really the approach that we've taken over the last few years.
Yeah, you beat me to it. I was going to ask, how is that going for you, the organizational structure? It sounds pretty weak. Are there any challenges that come up? And if so, how are you tackling?
Yeah, I think with every organization, there's challenges. I mean, we're facing a lot of challenges today, which I know we'll get into in a few minutes. But I think that it's the same with any organization. It's the same challenges that you have. At the heart of it, it's still people, right? It's still people. It's still change. It's still new. It's, some of the old. And I think that just creates and presents its own set of responsibilities and challenges at the end of the day. As a family physician, it's all about change as well. It's changing people's behaviors. It's changing, courses of disease. It's changing those things. So I feel like whether I'm practicing or leading, it's at the end of the day, it is about change. And I do think that primary care background has in a lot of ways helped as I've moved into a more administrative role.
I've heard many of your interviews that you kind of have this full list of so many things going on. But what is one project that you're working on today that you're most excited about?
Yeah, probably the biggest one that we're working on right now is we're in the process of implementing a CRM. And we partnered with Microsoft to do this. And so that project has kicked off. And we really feel that's going to be a game changer for us. We have not had an enterprise CRM to date. And so as we're really, trying to understand the longitudinal patient journey, we feel that having that level of information and connection and personalization is really important along the way. And so that's probably the biggest project, that we're looking forward to in that space.
What is something that you kind of look back on saying, I wish I had done this maybe better or differently? And also, what kind of motivated you to initiate this project?
Yeah, no, it started out, we have a digital steering committee, and it really started out of understanding, really wanting to be able to create that longitudinal frictionless journey. And so the project started, the contracts were signed in September, but as there's a lot of preparation and planning. And I think that if I had to do one thing over again, looking back, it's a delicate balance. Did we do enough stakeholder input, stakeholder analysis, getting people at the table as we were making this decision? I think you at one point or at some point you can get into analysis paralysis, and then that just bogs everything down. So at the end of the day, you have to move forward in some direction. And so, I think that we've learned that along the way. We've really tried to be diligent about bringing people along as the implementation phase and the building phase has started. I think the other thing is probably helping people understand the why, and that really comes back to more of our technical folks understanding the why, our IT, our analytics, our business relationship team, really helping them understand the why and why it's so important. And it's not just another technology that we're trying to, layer on top of everything else.
When you embark on these projects, how do you, as Chief Transformation Officer, measure the success in tangible ways? How do you set the standard? Where are your benchmarks coming from?
Yeah, that's a great question, but it's also a difficult question to answer. So, of course, we set, the measures of success. We always try to go into all of our projects with what are we trying to change? What problem are we trying to solve? And then identify measures of success. So certainly there's the one that everybody's interested in, the financial measures of success. Is it driving growth? Is it driving efficiency? Is it taking work off people's plate? That's a little bit harder to measure or harder to quantify. One of the things that we're very proud of that we've done over the last few years as we've been looking at clinical variation and reducing unnecessary waste and other things is we've embedded finance directors on our improvement teams. And so we have somebody that has that financial, mindset, really looking at, are these projects improving, the care that we're delivering? So I think that we really try to be mindful of, again, what problem are we trying to solve? How are we going to measure the success and carry that through the project from the very beginning? I think oftentimes organizations will get, they know they need to do it. They'll implement a project or a technology, and then they'll think, oh man, how are we going to measure the success? And so you have to really look across the board. Is it driving patient experience? Is it making it easier for people to interact with your system? And I think all of those are quantifiable. Everybody wants to focus on just the financial, and I think you should, but there's a lot of other measures that you should look at across the board.
Right, and you have that ultimate goal of making the patient experience almost seamless or as frictionless as possible. So What are you learning and hearing from clinicians and patients around you? What do you hope to learn from them in a few months from now? And how will you try to learn from them? Will it be through PSAT scores? Will it be through surveys?
Yeah. One of the things that we have really tried to do at Community is we have a very robust medical director structure with our physicians and advanced practice providers, and really drive communication in a closed loop manner. So hear the feedback on technologies. We have a very robust informatics team. We have a team of what we call site support analysts. So they go to the elbow, they're teaching, they're training, they're updating, they're educating on new features, new functionality, new technologies. So that's a very valuable source of feedback from the trenches, from people that are living it every day and interacting and dealing with. Certainly we'll measure things through our patient satisfaction surveys. And I can give you an example of that in a second. But I think one of the things that we really are interested in is there's so much going on in healthcare right now. Coming out of the pandemic, this new with the triple-demic that everybody's talking about with flu, COVID, and RSV, there's still a significant amount of stress. So how do we implement things that are not contributing to that stress? We really want to be taking things off their plate. But by default, when you introduce a new technology, a new workflow, a new feature, a new whatever it might be, by definition, that's something new that's getting added. So people feel that. And so you have to be diligent about what are you taking off their plate and how are you educating them that this is not necessarily one more thing. It's not one more thing to learn. It's not one more thing to do. but it's all part of the longitudinal continuum that, we can take things off their plate. So one of the things, to give you an example, one of the things that we have had some feedback recently is on our e-check-in process. So we've had some anecdotal feedback that it's cumbersome and it's duplicative and everything else. So we said, hey, let's get some data, let's measure it. So when patients schedule an appointment at community, they now receive a text survey of, did the appointment meet your expectations? So there's a lot of ways. It goes back to your question of how do you measure. There's a lot of ways to measure access and capacity. There's third next available, there's schedule capacity, there's all kinds of ways to slice it. People look at this for years. But we really wanted the voice of the patient. Did the appointment that you received meet your needs, right? At the end of the day, that's what we're striving for. And then we can educate them to the next best step about, okay, when you're having your appointment, you can check in online. So then we know that if they checked in online, so after their visit or after their encounter, we can survey them with a couple questions about, how was the e-check-in process? Was it frictionless? Was it easy? Was it understandable? So it's really creating that closed loop thing. It's one thing to just put things out there and hope they survive or hope they're successful, but can you objectively measure? I think that goes back to your question of how do you measure the success? Everybody's dealing with labor shortages. Everybody's dealing with access challenges. Everyone's dealing with the financial pressures on healthcare organizations right now. And so I think at the end of the day, it's how do you run a health system with those challenges and all of the external pressures that are facing the economy, world instability, the situation in Ukraine, all those types of supply chain, all of those types of things do impact healthcare. And I think people sometimes forget that. They think it's just about hospitals and procedures and surgeries and, inpatient admissions and going to your doctor. And it's really more complicated than that, as most industries are. But healthcare is not immune from that.
Mm-hmm. Yep. I hear the same from all of our guests. What do you think healthcare needs the most in the coming 5 to 10 years?
I think healthcare could really benefit from a couple of things. One is more transparency across the board. So we talk about price. That's not what I'm talking about, price transparency or other things. It's really transparency about how healthcare operates from the payer, the provider, the patient, the employer, the government. I think there's a fundamental misunderstanding at the end of the day of how things run and operate. So I think we need more transparency and education on them. I think the other thing that we need is more partnership. So everybody's beating each other up when it comes to the challenges that we're having, whether it's 340B or some government programs or the payers or the providers. And I think that we need more partnership. That sounds Pollyannish, and I'm obviously a realistic when it comes to those conversations and the stakeholders involved. But I think we need some real transparent partnership type of conversations. We're trying to have those with several of the payers in our market. And I'm happy to say, I feel like that they're progressing in the right direction. They're very positive. At the end of the day, we're ultimately trying to take care of people. And, how do we do that? How do we do that in a productive way to achieve the outcomes that everybody wants?
What emerging technologies are on your wish list, if at all?
I think that there's a lot of activity in I'm going to give you a couple narrow answers. We could probably talk for hours about this specific question, but I think that there's still some disconnects outside of the health system, meaning when a patient leaves the hospital and they go to a nursing home or they go to acute rehab or they go to home care, those are on different systems. There's, those EMRs don't connect. And whether you think the solution is interoperability or health information exchanges, we can debate what the solution is. But there needs to be better connection outside of the four walls of the health system. So I would love to see more innovation, more technology, more partnership in that space. I think that's a huge disconnect. It's a huge disconnect for patients. Very confusing. I think it leads to a lot of errors, unnecessary care, readmissions, increased cost of care. So I think that that's an area where technology and partnership could absolutely bend the curve. I would love to see more artificial intelligence, whether it's artificial or augmented. We tend to use the word augmented intelligence, when it comes to clinical delivery, but love to see more AI within the EMR itself. So oftentimes we're talking about layering on, AI in other areas like rev cycle or patient engagement, but within the EMRs, there needs to be more automation and technology. Because I think it goes back to our earlier question of how do you take work off people's plate? If it's, years ago we talked about counting clicks and this and that. I think there's a huge opportunity to automate many of those tasks within the EMR.
What kind of automation would you like to see there?
There could be automation of refills, right? So if a patient meets the criteria and predefined clinical criteria needs a refill, why does somebody need to touch that? Whether it's health maintenance things. If a woman is ready for a mammogram, why do you need somebody to touch? Oftentimes there's 2 or 3 people that are touching having a mammogram ordered. And that's just in some of those back office clinical things. There's opportunities to automate prior authorizations and other things. And I know that there's activity in all these spaces, so that's not what I'm saying. I just think it tends to be very siloed, and oftentimes it tends to live outside of the EMR. At the end of the day, the EMR still is the backbone now of the care delivery model. And so how do we do more within the EMR, layering it in to take some of that work off? And again, guiding clinicians, whether that's physicians, APPs, nurses, medical assistants, guiding them to the next best step. It's still, at the end, it's still very manual in a lot of situations.
So Patrick, I know you have many success stories to share, but if you could choose one success story that really stuck with you in your career that others can also learn from, what would it be?
That's a great question. It's also a hard question. I think and I mentioned it earlier, I think when we separated analytics out of IT and created the separate office of analytics, that was no easy task. And that started with, basically it was a department of one, which was me at the time. So I had to build a team. Obviously, we had analytics resources within the organization, but building that team, that was not a popular decision. I was not a popular person at the time, but I had been charged from our executive committee, our board, our CEO, to make the organization more data-driven. You often hear this. We have more data than we know what to do with. We have a lot of, we're swimming in data, but not in information. And we were in that same boat. And so what it took was I had to reach outside the organization for input and guidance and advice. And we worked together to build a strategy, and then it was executing on that strategy. And I think, oftentimes people will hit roadblocks, they'll hit bumps, they'll hit resistance, and they might give up, or they might change direction. And I think, that's a personal example for me where I was giving a duty or a charge to stand this up. And I think we've been very successful. I think we have the results to show that we've been successful, and we get up every day to try and make the organization more data driven, data informed. And I think but the message to others would be, don't let some of those roadblocks or barriers derail what you know is right. And I think you have to be persistent. I think a lot of times you have to understand that transformation is change. So if you're not changing things, are you truly transforming? And sometimes we get resistance and people are frustrated and they think, well, this is the way we've done things all along. So you have to realize, and we talked about this earlier, that we're still dealing with people. And so if transformation is change, and at the end of oftentimes change is a loss for somebody. It's either a loss of control, autonomy, loss of way they used to do things, loss of things.
Status quo.
That you have to recognize that. And so, sometimes some days are harder than others. And at the end of the day, you think, what did I really accomplish today? And, I think that, again, I always tell myself, if things aren't being disrupted, are you truly transforming the organization? And it goes back to what you said. You're right. Transformation is about one step at a time and making things better.
You're into a room filled with 100 new chief digital innovation transformation CIOs that are about to enter healthcare today. What are words of advice you'd like to leave them with?
I would start by saying, don't underestimate how complex healthcare is, and don't underestimate the longevity of some of the thoughts and ideas and the way that we do things in healthcare. Now, that's not necessarily mean make it right, but there's a lot of legacy things that go on in healthcare that are more difficult to change, transform, disrupt than maybe in other industries. The other thing is I would advise them to be prepared to meet friction, significant friction. So you have to be persistent. And then the last piece of advice, which I often give a lot of people, is never lose that curiosity. Never lose the questioning. Why do we do things? Is there a better way to do things? It's kind of always be curious, right? And I think oftentimes you see people that lose that curiosity and they fall back into just the way things have always been. So that curiosity can drive a lot of transformation. And so that's the piece of advice that I would give a lot of people as they enter healthcare, especially as you're trying to digitally transform or just change an organization overall.
I want to thank you so much for taking the time.
Great conversation.
Thank you for listening to Patient Journey Pioneers, brought to you by Hyro. Subscribe to our podcast on your favorite listening platform. See you on our next episode.